For over a century, in almost every province in Canada, the United Church of Canada, either as the United Church or as one of its founding churches, has been involved in the direct delivery of medical care. We have been involved with over 35 hospitals focusing on isolated, rural, and marginalized communities where without our services there might not otherwise be high-quality medical care available. We have sought to offer service to Native communities, farming communities, and other areas where high-quality, innovative medical care is called for. Villages on both coasts of Canada, and many communities in between, have been served by the dedicated medical, nursing, and administrative staff of the United Church. Where men, women, and children need the attention of physicians and nurses with the dedication to health care that arises out of Christian conviction. Over the past several years, the AOTS support for the Church's national health care work has made our service one recognized for its dedication. The United Church's Health Service has, with your help, made the provision of caring and compassionate health services a reality. The following brief story of our present service is intended to recognize your commitment in assisting us and also serves as a thank you to the many United Church men across the country who have contributed so generously to communities which most have never seen. In the early days, a number of groups in the United Church were involved with the provision of health care. The WMS, the Whole Mission Board, and other groups contributed. Of the present hospitals in our service, one of the early beneficiaries was the Hospital and Community in Lamont, Alberta. Dr. Morley Young, shown here presenting a graduation certificate to one of the nurses from the nursing school at the Archer Memorial Hospital in Lamont, worked for many years. Raised by the quality of his medical work, the hospital has risen to a position of prominence right across Canada. Today, the hospital and its associated intermediate and long-term care buildings, comprising over 100 beds, is known as the Lamont Healthcare Centre and carries the tradition established by Drs. Archer and Young and the many nurses who graduated from its nursing school. Lamont is now something of a retirement community for its area of Alberta, and it continues to set high standards of quality care. One of the most recent arrivals on our healthcare scene was the hospital in Baie Verte, Newfoundland. The United Church was approached by the Smallwood government some 30 years ago to assist in the development of healthcare services in this outport community. We have just recently withdrawn our direct responsibilities for the management of this facility when it became clear that the community had the capability to manage it quite well on its own. The AOTS provided dental equipment for the development of dental services in the community very many years ago. Our work is now focused in British Columbia, where we provide services and staff to 3 hospitals and 4 clinics directly connected with the United Church, and to 2 other communities which have sought some specific help from us in the last couple of years. These communities are separated by rugged coastline and mountains and distances of over 400 miles, so it makes sense to serve them by way of private aircraft. The remainder of this story will take you on a flight in a Cessna 182 to our various sites of work around the province. Our first port of call will be the community of Bella Bella, which we reach by way of a 1.5 to 2 hour flight through rugged coastal mountains from the Bulkley Valley in West British Columbia. Over superb alpine lakes, and over coastal inlets to the community of Bella Bella. Bella Bella is a largely native community of 2,500 people located on an island about 200 miles north of Vancouver. Here in a well-equipped modern hospital, with a staff of 3 physicians, we have provided medical service to this community for close to 90 years. As a native community, it is one that is awakening in its cultural strengths and heritage. recovering its identity and self-confidence and growing in vitality. Its staff is made up largely of local people, although the physicians and some nursing and administrative staff come from outside the community. The AOTS has recently provided a critical piece of equipment to this hospital at a cost of $14,000. In isolated communities such as this, and incubated to support the life of a timely premature or early newborn child who may have respiratory problems in maintenance of temperature, or who may require support before they can be flown to the intensive pediatric care in other communities, has been provided. The nursing staff and mothers of this community are eternally grateful for the provision of this equipment, which the hospital could not afford to purchase out of its very small equipment budget. The medical staff of this community provides services in a well-equipped clinic and emergency services as well. Not uncommonly, loggers, fishermen, and others traveling on the coast are brought to our small 23-bed hospital in Bella Bella for emergency care. They arrive by all means of transportation, by helicopter, boat, and sometimes by aircraft. Bella Bella is on the Inside Passage where ocean liners travel between San Francisco and Alaska. It is the only hospital on the coast, and it is a focal point when there are medical emergencies. On occasion, passing cruise liners will stop and offload passengers who have become seriously ill in order to receive attention at our hospital. The community receives ferry service once a week and is an active fishing center out of which many fishing boats are based.